The real cause of high blood pressure. When someone gets diagnosed with high blood pressure, the advice is almost automatic: cut out the salt. And that sounds reasonable. It's simple and feels like something concrete to do. But here's the problem. For many people, that advice is incomplete at best. And at worst, it points them in a completely wrong direction. And not because salt is irrelevant. It's not. But because salt is only a small piece of a much larger problem. So when you focus on salt or sodium alone, you ignore the real drivers of why blood pressure went up in the first place. But before getting to those factors, there is something fundamental about sodium that needs to be explained, and the answer might surprise you. What this video will show you. In this video, I want to walk you through the real causes of high blood pressure that often get overlooked. These are things you can actually act on today. And in many cases, once you fix them, your blood pressure will come down quickly without any medications. We are going to talk about nutrient deficiencies, metabolic factors, and hormonal drivers that cause high blood pressure. Because once you understand these often ignored driving forces, you will see why the usual one-size-fits-all advice never gets to the root cause of the problem. And that is why so many people end up with a chronic condition and are forced to stay on medications long-term. And the first point starts exactly with what everyone thinks they already know, but actually gets wrong. How salt really affects your body. The way this works is the following. Sodium raises blood pressure by pulling water into the bloodstream, which increases blood volume, which can then raise the pressure inside the arteries. That part is true. But what rarely gets explained is what happens next in a healthy body, if the kidneys are working well. They sense that rise in blood pressure almost immediately, and in response they excrete excess sodium and excess water through the urine. And as that excess volume comes down, blood pressure comes back down with it. This mechanism works remarkably well in healthy individuals. And there is a very important reason for this that completely changes the way you should look at high blood pressure. You are about to understand it. Why some people are more sensitive to salt. That is why many people can eat salt or eat foods with a high sodium content without developing high blood pressure. And that is why there is such a wide variability in salt sensitivity from person to person. Some people are very salt sensitive and others barely respond at all. So when blood pressure stays high even after you cut back on the sodium, well, that tells you something important. The issue is not the sodium you are eating. The issue is how your body is processing it. And this is where the real causes of high blood pressure start to show up. And one of the first things I look at is a mineral that almost half the population does not consume in sufficient amounts. Magnesium and your blood vessels. Magnesium plays an absolutely critical role in blood pressure regulation. Magnesium boosts nitric oxide and prostacyclin, and both of those things help relax and widen your blood vessels. So when magnesium is low, blood vessels stay more constricted than they should, and that makes it more difficult for blood to move. This is what causes your blood pressure to go up. And the reason I emphasize magnesium is because low magnesium is very common. Some estimates say almost half of the United States population does not get enough magnesium through their diet. And we see this in observational data too. There is a meta-analysis of 22 studies that found that people with lower magnesium levels had higher odds of high blood pressure. And the lower the magnesium, the higher the risk. But why are so many people deficient in magnesium at the same time? The answer lies in something you eat every day without realizing it. Why magnesium deficiency is so common. Why are so many people deficient in magnesium all of a sudden? Well, a big part of it is the food we eat. We are talking about refined grains, sugary foods, and processed foods. These foods lack many essential minerals, including magnesium. And eating a lot of sugar also makes your body lose magnesium in your urine, which then makes the problem even worse. And even if you do get enough magnesium through your diet on paper, you may still not be getting enough. That is because modern farming often pulls minerals out of the soil faster than they are being replaced. So the food looks the same, but it has less magnesium than it did just a few decades ago. If fixing magnesium through diet alone is already difficult, imagine what science has discovered about supplementing this mineral directly. The numbers are more impressive than you might think. What science says about magnesium supplementation. The way I would approach this is by prioritizing magnesium-rich foods. That would be foods like leafy greens, legumes, nuts, and dairy. Just know that even a good diet today gives you less magnesium than the same foods gave people in the past. For that reason, many people would actually benefit from taking a magnesium supplement. And this is definitely something to discuss with your doctor if you have high blood pressure. There is a recent meta-analysis of 38 randomized controlled trials that found that magnesium supplementation, with a median dose of 365 milligrams per day for 12 weeks, produced small but meaningful reductions in both systolic and diastolic blood pressure. And the blood pressure lowering effect was even greater in people with high blood pressure who were taking medications. In that population, magnesium supplementation resulted in a drop of almost 8 millimeters of mercury in systolic blood pressure. But magnesium is only the beginning. There is a hormone your body produces every day that may be sabotaging your blood pressure without you even realizing it. Insulin retains sodium and raises blood pressure. Now let's talk about insulin, because insulin is one of the most underappreciated blood pressure hormones. When insulin levels are elevated, the kidneys start to retain sodium. They just stop letting go. And as a result, your kidneys hold on to sodium and they hold on to water, and that in turn causes your blood pressure to go up. And this happens even if the sodium intake has not changed at all. This is why people with insulin resistance, prediabetes, or type 2 diabetes often end up with high blood pressure. And it is also why blood pressure often gets better when insulin levels drop, even before someone loses much weight. So this is another reason why cutting out processed foods, refined carbohydrates, and sugars helps your blood pressure even more than a low-salt diet. But inside those processed foods, there is one specific ingredient that very few people know about, and that causes even more damage. The fructose that raises uric acid. Salt or sodium can temporarily raise your blood pressure, but it is the persistently high insulin levels that turn this into a chronic problem. And this is also where fructose enters the picture. Fructose is just a simple sugar that is used as a sweetener or as a preservative in many processed foods. I often talk about the problems with getting too much fructose in my other videos, especially when it comes to fatty liver. When you consume a lot of fructose from processed foods or drinks, your body makes a lot more uric acid, and that is one of the things that causes high blood pressure. Because high uric acid gets in the way of nitric oxide, which is supposed to keep your blood vessels relaxed. And it also makes blood vessels stiffer and makes it much more challenging for your kidneys to get rid of sodium. And what happens when you treat that uric acid directly? The results I see in my patients are remarkable. How to treat uric acid and reverse blood pressure. Uric acid is actually one of the labs I routinely check in all of my patients, especially if they have high blood pressure. I have seen many cases where blood pressure comes back to normal simply by cutting down on fructose and lowering uric acid. And if diet alone is not enough, we sometimes use a medication called allopurinol, which most people know for gout, but it can also help with blood pressure if uric acid is the cause. But the bigger point is this: if you cut out sugars and processed foods, that helps both your insulin resistance and your high uric acid levels. And it is pretty remarkable how fixing just these two things can rapidly reverse your blood pressure, even without your typical blood pressure medications. And that is the theme you will keep noticing. High blood pressure is not caused by one big mistake or one big reason. More often than not, it is caused by many small physiologic stresses that just add up together to cause big problems. And there is still one mineral that acts in two places at the same time, including directly in your brain: potassium in the blood vessels and kidneys. Another major piece of the puzzle that often gets ignored is potassium. Potassium works in two main places in the body. First, it works in your blood vessels and in your kidneys. Potassium helps blood vessels relax, and it tells your kidneys to get rid of extra sodium in your urine, so it basically counteracts sodium retention, which then lowers the pressure inside your blood vessels. And the reason I bring this up is because our typical modern diets are very low in potassium and very high in sodium, which is the opposite of what supports a healthy blood pressure. And this imbalance alone can push your blood pressure up, even if your total sodium intake does not look that high. But potassium does not stop there. It also acts in a place no one would expect. And that effect may be even more important than what happens in the kidneys. Potassium acts directly in the brain. When potassium levels go up, especially in the brain and in the cerebrospinal fluid, it turns down the sympathetic nerve activity, which is basically your fight or flight system, the system that typically raises your blood pressure under stress. By calming that signal, potassium helps quiet the nervous system and reduces the hormones that normally raise your blood pressure. And when you combine low potassium with high insulin, high uric acid, and low magnesium, well, this is the perfect storm that makes your body hold on to sodium and keeps your blood pressure elevated over time. If you want to know exactly which foods to put on your plate to fix all of this, the following list will show you the most direct path, the best foods to increase potassium. So if you want to add more potassium to your routine, my personal favorite foods would be root vegetables. That would be things like potatoes or sweet potatoes, and then vine fruits like tomatoes, cucumbers, and eggplants. Leafy greens like spinach are also high in potassium. And do not forget legumes like chickpeas, beans, and peas, as those things will also give you a lot of good fiber. And by the way, if you are keeping track, a lot of these foods would also help you get more magnesium in, so you get a double benefit. But what has been covered so far is still far from the full picture. There are other factors that rarely come up in medical appointments, and that may be behind the most difficult cases to control. The factors that will still be revealed. This is not a full list of all the things that can raise your blood pressure. What we have not talked about is how other micronutrient or vitamin deficiencies can also play a role. That would be things like vitamin D or B12. We have not talked about homocysteine, because that matters too. And so do stress and sleep, and even secondary endocrine disorders like primary aldosteronism, which actually shows up in anywhere from 8 to 20% of cases of resistant high blood pressure. But I am going to go deeper into those topics in my future videos. The key takeaway is to address these factors early, before the damage in the blood vessels sets in. Because once the damage builds up, and your blood vessels become stiff and lose elasticity, well, that is when high blood pressure becomes much more difficult to reverse. I hope this is helpful. Stay healthy, and I will see you in the next one.